Dr. McCarthy, and I want to welcome you to the 12 Days of Christmas Health Success Tips. Today we're going to talk about anemia. Anemia is actually a group of a couple of different types of disorders with your red blood cells that prohibit the red blood cells from carrying oxygen. What happens is when you breathe oxygen into your lungs, red blood cells pick up your oxygen molecules and they carry it around throughout your body and they drop it off at all the different cells in your body that need oxygen. Oxygen is needed to produce energy, or ATP. When you are dealing with a condition called anemia, your red blood cells become less efficient at carrying that oxygen around. So one of the hallmarks of our comprehensive blood work that we do is we look for different types of anemias. We look for different patterns that clue us into the fact that your body might not be utilizing oxygen as well as it's supposed to. There's a couple of different kinds of anemia, and some of the most common ones that we see are iron deficiency anemias. There's many different causes for that, and you'd be surprised to know that we don't really give a whole lot of iron supplements to people who have an iron deficiency. If you're dealing with an iron deficiency anemia, you're taking iron, and you still feel miserable, you belong in my office. I can show you how to fix this problem. Another type of anemia that we deal with very frequently is B vitamin deficiency, B6, B12, folate deficiency, and again, what we do now in this case is we have to do the proper lab tests to determine what exactly is the cause of your anemia. Then we can do a replacement type model. We can supplement with specific B vitamins, and then we can run the tests again a couple of weeks or a couple of months down the road to make sure that your levels have come back into the normal range. We utilize oxygen or different breathing techniques with a lot of our patients in order to get more oxygen to their brain. Now, you can do all the best deep breathing exercises. You can be an aerobic exerciser. You can do lots of good things for yourself. But if you're dealing with an anemia situation, you're not reaping the benefits of getting this supplemental oxygen into your body. Your brain craves oxygen and fuel. The fuel comes in the form of glucose, your food. We're going to cover that in a subsequent video. But as far as this one's concerned, if you want to utilize your oxygen properly, you need to make sure that there's no anemias present. You need to get tested properly. If you haven't been tested properly, or if you have been tested and you're dealing with these problems and you're not happy with the results, call my office and set up time to come on in. We'll look over your old labs and we'll tell you exactly how we would manage the situation for you. Thank you.